You know that feeling when your dog, who's usually bouncing off the walls, just seems quiet,
Yeah.
maybe a bit more tired, maybe there's a little cough you notice now and then,
Mm.
and you go online, right? And suddenly it's just this avalanche of medical jargon. It feels impossible.
It really can be overwhelming.
So that's what we're trying to do here. This deep dive is really focused on giving you the essential info about a very serious heart condition in dogs,
Right.
cardiac hemangiosarcoma.
Right. We want to cut through the noise.
Exactly. Not to overwhelm you, but to give you the knowledge that actually helps.
And we've been looking at some professional veterinary resources, specifically excerpts from Canine Cardiac Hemangiosarcoma Management. Dense stuff,
Yeah.
but our mission, really, is to pull out the most crucial bits. What is this thing, fundamentally? Who does it affect? How do vets spot it? And what's the general outlook?
Just the essentials. Clarity.
Precisely.
Okay, so let's jump right in. In simple terms, what is cardiac hemangiosarcoma?
Okay, so think of it like this. It's a really aggressive cancer. It starts in the cells that line blood vessels.
Okay, blood vessel lining.
And the cardiac part means it's happening specifically in the heart.
Got it.
And actually, it's the most common heart tumor we find in dogs.
Wow, most common. That really puts it into perspective.
It does.
And can it start anywhere in the heart, or is there a typical spot?
Well, it can spread to the heart from elsewhere. That happens sometimes. But when it originates in the heart, the most common place is the right atrium. That's one of the top chambers.
To right atrium. Okay.
Or sometimes in this little pouch attached to it called the right auricular appendage.
So it often starts right there. And what makes it so particularly dangerous? You said aggressive.
Yeah, aggressive because it spreads. It metastasizes.
Right.
It has this significant ability to travel to other organs. The literature mentions, lungs, kidneys, muscle, even the lining of the abdomen.
Oh, wow.
So this tendency to spread widely is a big part of why it's so serious.
Yeah.
It's like it sends out feelers everywhere.
That really paints a clear, if worrying picture. Okay, so knowing that, who's most at risk? Which dogs?
Right, so it's primarily a dog issue. It's actually pretty rare in cats, which is worth noting.
Okay, good to know.
But in dogs, yes, certain breeds definitely have a higher predisposition. The ones that really stand out are German Shepherds, Labrador Retrievers, and Golden Retrievers.
German Shepherds, Labs, Goldens. Okay, that's key info for a lot of owners.
Absolutely.
And what about age? Does it affect puppies or?
Generally, no. It tends to affect middle-aged to older dogs. That's the typical window.
Middle-aged, older.
And there's maybe a slight suggestion that male dogs might be slightly more prone, but it's not a huge difference.
Okay, so breed and age are the main factors then. Now, for someone at home, what are the signs? What might you actually see in your dog?
The signs often stem from fluid building up around the heart. We call that pericardial effusion.
Fluid around the heart.
Yeah. And that fluid puts pressure on the heart. That's cardiac tamponade. So you might see signs related to that or to right-sided heart failure.
And what would those signs look like day to day?
Things owners might report. Wow. Episodes of collapse, just suddenly collapsing, or seeming really lethargic, weak, maybe not wanting to eat.
Loss of appetite. Okay.
A cough can develop. Difficulty breathing, like panting more or seeming short of breath, sometimes vomiting, and just a general reluctance to exercise, not wanting to go for walks like they used to.
Yeah, those changes can be subtle at first, I guess.
They can be. And worrying when you notice them stack up.
So if you bring your dog in with those kinds of concerns, what might the vet find during an exam that points more specifically towards this?
During the physical exam, a vet might hear muffled heart or lung sounds because of the fluid.
Oh, okay.
They might detect an irregular heartbeat and arrhythmia. Feeling the pulses, they might be weak or even seem to disappear briefly when the dog breathes in. That's called pulsus paradoxus.
Pulsus paradoxus. Interesting.
Yeah, it happens when the pressure around the heart really restricts how it fills. Other things, maybe swollen neck veins, the jugular veins, or an enlarged liver, which we call hepatomegaly.
So more concrete clues for the vet.
Exactly. Physical findings that raise the index of suspicion.
We know what it is and the signs, but why does it happen? Are there known causes or risk factors? You mentioned genetics earlier with the breeds.
Right. In dogs, researchers have identified some specific genetic abnormalities. Things like an overactive protein called STAT3
STAT3?
and mutations in genes that are supposed to suppress tumors, like P53 and PTN.
So the body's natural defenses are down.
In a way, yes. Or there's something actively promoting growth. They've also found increased levels of factors that encourage new blood vessel growth, vascular endothelial growth factor, VEGF, and angiopoietins.
Which would feed the tumor, essentially.
Exactly. It helps build that abnormal network. It's complex, but gives us some clues about the biology.
And for cats, you said it's rare, but any known causes there?
Interestingly, no. The source material specifically states that no causes or risk factors have been identified in cats.
Okay, so the vet suspects it based on the signs, the exam. How do they actually confirm it? What's the diagnostic process?
It's a process of elimination, really, what vets call differential diagnosis.
Ruling things out.
Exactly. You have a list of possibilities. Other heart tumors may be fluid buildup for no known reason, which is idiopathic pericardial effusion.
Idiopathic, meaning unknown cause.
Right. Or other things causing heart failure or arrhythmias. You need to rule those out.
Right.
And then you move on to tests.
What kinds of tests are we talking about? Blood tests?
Blood tests are definitely a big part of it. They can show things like anemia, but it's often regenerative, meaning the body's trying to make more red blood cells.
Okay.
Also, a low platelet count, thrombocytopenia. And sometimes you see weirdly shaped red blood cells.
Weird shapes. Like how?
The names are a bit technical: acanthocytes, cystocytes. They can get damage flowing through the abnormal tumor vessels.
Ah, that makes sense.
You might also see an increase in certain white blood cells, which are neutrophils. So yeah, the blood work provides important clues.
Are there other lab tests besides the standard blood count?
Yes, a coagulation panel is really important. That looks at blood clotting.
Checking how the blood clots.
Right. Tests like PT, PTT, D-dimers, fibrinogen. Because sometimes, with these aggressive cancers, the whole clotting system can go haywire.
Haywire how?
Well, significantly, up to half the dogs with this condition might meet the criteria for something called DIC, disseminated intravascular coagulation, which is a very serious clotting disorder.
Half the dogs. Wow, that sounds critical.
It is. It adds another layer of complexity.
So blood tests, clotting tests. What about imaging? X-rays, ultrasounds?
Imaging is absolutely vital. Chest x-rays or radiographs are usually done.
What can they show?
They might show an enlarged heart shape, sometimes described as globoid, like a globe.
Globoid, okay.
They can also show fluid in the chest cavity, pleural effusion, and, importantly, check if the cancer has spread to the lungs, which is pulmonary metastasis.
And ultrasound.
Abdominal ultrasound is also key. You need to check other organs, like the spleen and liver, for signs of spread, or even a primary tumor there. Look for nodules, free fluid in the abdomen, hemoabdomen.
So checking for spread elsewhere, what about looking directly at the heart with ultrasound?
Yes, that's echocardiography. Crucial. It lets the vet see the heart structure, identify that pericardial effusion we talked about,
And drain it.
and potentially drain it, yes. It also helps visualize the tumor itself, where it is, how big it is.
Okay.
And sometimes, for more detail, especially if surgery is being considered, advanced imaging like MRI or CT might be used.
So all these tests build the picture, but how do you get that definitive 100% confirmation?
The gold standard, the definitive diagnosis, requires a tissue biopsy.
Taking a piece of the tumor.
Exactly. Getting a sample and having a pathologist look at it under the microscope.
Yeah.
This can sometimes be done using thoracoscopy, a minimally invasive camera into the chest. It's important to know that just looking at the cells in that fluid around the heart usually isn't enough for a firm diagnosis.
Okay. Need the actual tissue.
Need the tissue.
Yep.
And while an ECG, the heart trace, might show arrhythmias, it's not specific for this tumor either. It's another piece of the puzzle.
So once you have that tissue sample, what does the tumor actually look like? Both, visually and under the microscope.
Grossly, meaning what you see with the naked eye, it's typically a single mass, usually on the right side of the heart. It often looks hemorrhagic, bloody, and can be quite fragile.
Fragile, okay.
Then, microscopically, the pathologist sees these abnormal cells, mesenchymal cells, forming irregular blood-filled channels within the tumor. There's often a lot of dead tissue, necrosis, and signs of bleeding within the mass itself.
That gives a really clear, albeit grim, description. Okay, let's shift to treatment. Once it's diagnosed, what can be done? What are the options and, frankly, the outlook?
Well, for immediate relief, if there's a lot of that fluid causing pressure, draining at pericardiocentesis can help temporarily.
Buying some time, basically.
Yeah. Buying time, improving comfort. Another option, more palliative, is creating a pericardial window surgically.
A window.
Yeah, often done via thoracoscopy. It creates an opening so fluid can drain into the chest cavity instead of building up tightly around the heart. It reduces the risk of that life-threatening tamponade.
So that's palliative managing symptoms, not curing it.
Exactly. The best chance for longer-term control for actually tackling the cancer is surgical removal.
But is that often possible?
Unfortunately, it's usually only feasible if the tumor is in that atrial appendage or a very small part of the atrial wall. Often, it's too widespread or in a location that's just not operable.
That's tough. So if surgery isn't an option, what else? Chemotherapy?
Yes, chemotherapy is often used.
Yeah.
Doxorubicin is a common drug.
That's rubicin.
The studies suggest it can provide clinical benefit, maybe extending survival by a median about 4 months when the disease is measurable.
Dosage is based on weight, of course.
4 months median survival with chemo. Okay. There's also another approach called metronomic chemotherapy, using low-dose, continuous cyclophosphamide, often combined with an anti-inflammatory drug and NSAID, like Proxicam.
Metronomic. Lower dose, more often.
Right. Different strategy.
These are powerful drugs, though. What about side effects? Owners need to know what to expect, right?
Absolutely. It's crucial. Doxorubicin can cause tummy upset, lower blood cell counts from bone marrow suppression, potential heart issues, kidney issues, allergic reactions,
Wow, quite a list.
and tissue damage if it leaks out of the vein. Plus, there's risk of cumulative heart damage with repeated doses.
Okay. And the other one, cyclophosphamide.
That one carries a risk of sterile hemorrhagic cystitis bladder inflammation with bleeding.
Ouch.
And the NSAIDs, like Proxicam, can cause GI upset and potentially affect the liver or kidneys too.
So close monitoring during treatment is essential.
Absolutely essential. Regular follow-ups are key.
What does that involve?
Usually physical exams, blood work to check organ function and cell counts, chest x-rays to monitor for spread, and heart ultrasounds, typically every 2 to 3 months.
Okay.
And for dogs on that metronomic cyclophosphamide, monthly urine checks are recommended to watch for that bladder issue.
With something this serious and with genetic links, is there any way to prevent it?
Unfortunately, no. Based on the current information, like in the source we looked at, there's no known way to prevent or avoid cardiac hemangiosarcoma.
Right. And what are the main complications as the disease progresses?
A major one is congestive heart failure. The fluid buildup, the tumor itself pressing on the heart, it just makes it harder and harder for the heart to pump effectively.
Which leads back to those initial signs getting worse.
Exactly. Difficulty breathing,
Yeah.
lethargy, fluid accumulation elsewhere.
So bringing it all together, what's the overall expected course, the prognosis? Owners need that realistic picture, however hard it is.
Yeah, it is hard. The overall prognosis is generally guarded to poor. That's the reality.
Guarded to poor.
There's a significant risk of sudden death, either from that rapid fluid buildup, the tamponade, or from fatal arrhythmias, those irregular heartbeats.
And survival times.
Without treatment,
Yeah.
median survival is often less than a month.
Less than a month. Wow.
With doxorubicin chemo, as we said, maybe around 4 months median.
Hmm.
If surgery is possible and successful, it can potentially be longer. But again, that's less common.
Those are sobering numbers.
They really are. And for anyone listening, if you're facing this, the most important thing is using this knowledge to talk openly with your vet, to make informed decisions focused on your dog's quality of life.
Absolutely. Well, this has been incredibly informative, if definitely sobering. A really deep look at cardiac hemangiosarcoma.
It's a tough topic.
Yeah. The key things really are, it's serious, it's aggressive, especially in those specific breeds and older dogs. And spotting those early signs, getting to the vet quickly, it's just critical.
It really is. Prompt attention makes a difference. And while, yes, the prognosis is challenging, understanding the condition, the tests, the treatments, it empowers you.
Empowers you to have those crucial conversations with your vet.
Exactly. To make the best choices you can for your dog in that situation.
And it does make you wonder, doesn't it, with those genetic links identified?
Yeah.
For German Shepherds, Labs, Goldens, what might the future hold? Could we see earlier detection methods, maybe even preventative strategies down the line for those high-risk dogs?
That's the hope, isn't it? Further research, maybe genetic screening. It's definitely something to think about for the future.
Food for thought. Thank you so much for breaking this down for us today. Really valuable information.
You're welcome. Glad we could shed some light on it.